Good evening, everybody. So I came to know regarding this presentation, sort of presentation in the last moment. So I can't be able to show the presentation per se. I can say without any visuals. Okay. So topic is how to keep our heart healthy or healthy heart. How to manage to have a healthy heart. So first, I want to thank management team of ILTA Hospital to organize such a campaign like sort of thing to increase the awareness regarding healthy heart. So what comprises the cardiovascular system? So basic thing is that what comprises cardiovascular system? It is the heart, the blood vessels. It is the heart and the blood vessels which comprises the cardiovascular system. Heart has its own blood vascular supply, which we call coronary arteries. Occlusion of the coronary arteries or blockage of the coronary arteries leads to heart attack. And there are other vessels also, such that the blood vessels which carry blood to the organs in the brain, in the limbs, and the viscera. If in the brain the heart vessels gets blocked, we call it CV or cerebrovascular accident. If the same thing happens in the peripheral part of the body, we call it peripheral arterial diseases. And venous diseases also come in the same place. So cardiovascular system as a whole comprises as the heart, its blood supplies, as well as the vascular system which carries blood to the various systems of the body. So our motto is to make the whole CVS healthy. How we can do this? So after birth, when we start eating, our body generates fats, proteins, minerals, and vitamins. With this, we build our body. Along with the building our body, our blood vessels get depositions of this cholesterol. So cholesterol deposition start very early of our age, at the age of 7 years or 8 years of age. Okay, so it's a very slow procedure which ultimately at the end of 30, 40, 50, 60 is manifests as a coronary artery disease. The same thing can happen in the peripheral vessels also. So our motto is to make our blood vessels free from or less deposition of cholesterol. So one of the motto is to keep healthy heart or healthy cardiovascular system is to get rid of this cholesterol deposition first. Second thing is this: to maintain the cardiovascular rhythm as well as the blood pressure, our nervous system has to act accordingly. That is, our nervous system which controls the heart rate and the blood pressure is sympathetic and parasympathetic nervous system harmony. If somehow this harmony get damaged, then there will be arrhythmia, that is heart rhythm alteration, or there may be increased blood pressure. So to keep check on the blood pressure, we have to maintain our neurovascular system, nervous system in control, as well as the cardiovascular system in control. And third thing is that there are something which indirectly affect the CV cardiovascular system. What are those? One is notorious, it's called diabetes mellitus. With glycolated end product, that means if our blood sugar level gets raised, some chemical forms which we called glycosylated product, this get deposited in the cardiovascular system, nervous system, as well as the various system of the body, which ultimately leads to cardiovascular ill health. That means diabetes patients, they are prone to development of this sort of cardiovascular diseases. Next thing is this CKD or kidney disease. In chronic kidney disease, that when the kidneys are not functioning well, that waste material is they are getting deposited or they are inside our body, they are not excreted properly. So those have ill effect on the cardiac contractility, that is the cardiac function may be depressed. This can cause deposition of cholesterol as well as this coronary artery disease, and also increased blood pressure. So in kidney disease, we have increased blood pressure, coronary artery disease, as well as depressed cardiac contractility, in which ultimately manifests as low or decreased ejection fraction. And there are other modulators. Which are the modulators? One is the food habit, and second is the social factor, that is the addiction. Food habit, how does it affect? During this modernization, or what we can say, we are going to adapt, or we are adapting the Western culture. So we take much of these fried things or high lipid and high salt content foods. High salt content food can increase our blood pressure to the extent of more than 20 millimeter of mercury. High fat content food can lead to increased LDL cholesterol or cholesterol deposition or increased triglyceride level, which ultimately form small dense LDL particles which are notorious for causing this cardiovascular ill health. So if we can now summarize some form or some factors which are there, those are non-modifiable. Even if we try, we can't change those things. Like age. As we age, we are prone to develop this cardiovascular system. So we can control our age. So these are beyond our limit. Genetic factors. If we are genetically prone to development of this sort of heart attack or CVA, we can't do much because we are genetically programmed like this. But the other things, that is the blood pressure. If we control our blood pressure, we can prevent stroke and heart attack. If we can control our blood lipid profile with medications or with lifestyle modification, we can prevent heart attack, or we can prevent stroke, or we can prevent peripheral artery disease. If we can manage to maintain our blood sugar level in a normal or optimum level, we can prevent these increased MACE or major adverse cardiac events. Lastly, if we refrain from smoking, alcohol intake, or other sorts of this addiction, we can support our health system to the for betterment. So these are the factors which we can modify, and these are in our hand so that we can have a good cardiovascular system. Now, if we can take the data, what data says, the diabetic patients, almost 30 to 40% diabetic patients have cardiac diseases, and reverse, the almost 30 to 40% cardiac patients have diabetes. CKD patients, 20 to 30% of CKD patients have heart attack, heart failure, heart attack sort of thing. And the patients who are getting admitted with heart ailments, certain percentage of them are suffering from chronic kidney disease. Likewise, a major portion of them are having smoking as their addiction, and some form of hypertension or high salt intake. These are all in the list. So if we take together age, that will increase age, genetic predisposition or strong family history. Thirdly is the blood pressure level, lipid cholesterol level, sugar level, CKD, all actually are influencing our cardiovascular health. So our motto, how we can keep our heart or cardiovascular system healthy. So if we can modify or modulate the modifiable part. So if we take blood sugar level, if we maintain our HbA1c less than 6, then we can have this extra benefit of good CV health. If we maintain our blood pressure level less than 130, above by 85, then we can have this good cardiovascular health. If we maintain our LDL cholesterol level from less than 100, it's beneficial. If we refrain from smoking, it's beneficial. One thing is that both passive smoking, active smoking is notorious. Everybody knows. But some people, they are still asking that whether the e-cigarette is beneficial or not, or if e-cigarette have ill effect or not. It is proven from the last data published in the Government of India official bulletin. Even e-cigarette is notorious for the CV health. E-cigarette, it emits some sort of chemical structures which are not nicotine, but chemical structures contains nitric oxide and nitrogenous substance, which has very ill effect on the vascular endothelium, that is vascular health. So they also precipitate this heart attack. So smoking, whatever form it may be, is very bad for the health. So what we have already discussed is that to maintain our blood sugar level in check, and to maintain our blood pressure level, to monitor our kidney function time to time and prevent CKD formation or CKD progression. Fourthly, to maintain our salt intake to less than 5 gram per day for our purpose. And those who are already having some sort of this cardiac problems, less than 2 gram per day salt intake is sufficient. And to decrease our fat consumption, calorie consumption to the minimum possible level or lowest possible level, and Lastly, to maintain our nervous system. How can we maintain or take control of our nervous system? Some people, they are very nervous. Their heart rate increases in some um, absurd situation, which we can call this inappropriate sinus tachycardia. So, if we can control our nervous system by meditation or yoga, it is very good, so that we can decrease our sympathetic drive and increase our parasympathetic drive, which decreases the heart rate, decreases anxiety, decreases blood pressure, and keep the cardiovascular system healthy. So these are few things in a very short form that we can do or we can maintain to have our heart healthy. And one important thing is the food habit. So food habit, what the Western data says that lean meat, fresh legumes and vegetables, fresh fruits, nuts. These are few things which effectively improves our cardiovascular health. In our scenario, in Southeastern Asian region, we are very fond of this carbohydrate part of thing. Carbohydrate makes major part of our meal. Almost 40 to 50% of our meal or calorie comes from the carbohydrates. If we take much more carbohydrates and do less exercise, so the major portion of the carbohydrate con- converts into the fat, and they get deposited inside our abdominal viscera, the fat belly, and the fatty liver, all sort of things. So if we can cut down our carbohydrate intake to lesser minimum and increase our diet with proteins or these fresh vegetables, we definitely have extra edge to combat the ill effects of this hypercholesterolemia. So to for the food purpose, we have to avoid this fried thing or fried sort of things. We have to consume the vegetables or the fruits in the fresh form, not in processed or prepared form. So we can have vitamins from these foods at its maximum concentration, and to increase the is nuts consumption, legumes consumption, that is sprout consumption, which makes our body fit and healthy. At the same time, if we avoid fatty food or fried food, we can effectively lower our LDL cholesterol level inside our body. Even after these measurements or measures, if still our blood pressure remains high, our blood cholesterol remains high, sugar level remains high, we have to take medicines to keep this in check in balance. So these are in short how we can keep our heart healthy. And last but not the least, the exercise part. Any sort of fit and exercise is sufficient to maintain our heart healthy. The motto of the exercise is to increase secretion of endogenous endorphins, which improves our mental state, improves our improves the functioning of the body muscles. At the same time, it increases the calorie, or it actually helps us to burn our calorie, excess calorie, and to keep the LDL cholesterol level in a lower range. So, good exercise, regular basis exercise, at least 30 minutes per day for at least 5 or 6 days a week is sufficient. Along with it, the good food habit, avoidance of this addiction or smoking or alcohol intake. See, alcohol is one thing, that alcohol is directly converted into energy. So if we take complex carbohydrate or complex food, we have to first we have to digest them. Then after the digestion, we extract the actual nutrients from those food. But in case of alcohol, in case of free fat, it directly gets absorbed and directly gets stored as fat, and we don't have to use our energy to digest them. So this free form of energy is very notorious. So we have to avoid free form of energy, whatever may be the form, that is in the butter or oil or these fried things or this alcohol consumption. So, and as a whole, we have to refrain from the addiction. We have to maintain a healthy body by doing yoga or meditation, by keeping our nervous system in control. We have to maintain a healthy muscles and cardiovascular system by doing regular exercise at least 30 minutes per day for at least 5 or 6 days a week, and to know our risk factor, that is age, with growing age, we have to take extra precaution to maintain a optimum blood pressure level, to maintain optimum cholesterol level, to check our kidney status and take medicines accordingly, and to decrease our salt intake at least less than 5 grams per day. It will make your cardiovascular system healthy. So now this is very in very short. Actually, I have audio visual sort of things as a PowerPoint presentation, but I'm sorry that I couldn't arrange this thing, because it's very at the 11th hour I came to know that I have to present this thing. So in short, I discussed almost basic part. And if you have any questions, you can ask me directly or in chat box. Thank you.